plenty to know, right? Common meds that you most likely will see on your test, on your exam. What are some of the drugs that you gotta know, learn, what should you know? That's what we're gonna talk about in today's video. Hey, so before we move on, one thing I want to mention is that, it's really important to be able to stay awake, stay alert, right? And sometimes you want to do that without the crash and the burn that comes with like coffee and other things. So I want to recommend to you our energy shots here. These are all totally natural ingredients, okay? And it also contains like B6, B12. It does have caffeine in it, so it's gonna wake you right up, and it comes in both grape as well as orange. So these are our energy shots. Just click the link below this video and use the code that's included below the video, and you'll be able to get it at a special deal. You'll get a full pack, and this really lasts honestly for like a long time, and it tastes excellent. So let's go over some of these common medications. And I'm going to go over mainly, a lot of the drugs I'll go over will be a lot of cardiac drugs, and then maybe some other medications with other systems as well. The best place to honestly get started with the drugs, because you're more likely to miss a medication, a miss important one, if you try to focus on them individually one at a time, than if you instead focus on them based on the categories, right? So you categorize them instead. So heart drugs, immune drugs, respiratory drugs, like that. So let's talk about some drugs that you need to know as far as cardiac meds. So definitely gotta know antihypertensive drugs, right? That is a given, right? It's one of the most commonly prescribed medication is antihypertensive drugs, right? Your ACE inhibitors, your ARBs, your beta blockers, your calcium channel blockers, right? Those are some very common antihypertensive drugs. What you want to consider when you are learning these drugs is you need to understand how exactly do they work. So there's a difference where you call the drug mechanism, right? So that's how the drug works versus the rationale or the ideal outcome. So all the drugs I just listed, they all have the same outcome, which is to lower the blood pressure. But the mechanism is not the same, right? The mechanism is different as far as how they each work. So for example, ACE inhibitors, angiotensin converting enzyme inhibitors. Well, ACE is an enzyme that converts angiotensin 1 to angiotensin 2. Angiotensin 1 is a hormone that is produced as part of the ROS system. If you want to learn more about the ROS system, make sure you go and check out, watch the video about the ROS system. But angiotensin 1 is a hormone that the body produces as part of the ROS system. But when it's converted to angiotensin 2, that causes the blood pressure to be raised. So the main thing about the ACE inhibitor is that it stops the enzyme ACE, angiotensin converting enzyme, from turning from angiotensin 1 to angiotensin 2, so that way the blood pressure is not raised. Versus ARBs, right? With ARBs are work a little bit differently, right? So with ARBs, angiotensin receptor blockers, these ones are different. These are focusing more so on blocking angiotensin 2, period, right? So which are already causing the blood pressure to be raised. So pay attention to the mechanism of the drugs just as much as the rationale. Another one as well are your antiarrhythmic drugs. So antiarrhythmic drugs, these are the drugs that we give typically to patients that have like dysrhythmias, such as chronic dysrhythmias, such as your atrial fibrillation patients that have chronic on their history, but they may be on drugs such as amiodarone. Amiodarone helps to stabilize the rhythm of the patient, right? So, and that is important so that way they don't go into VTAC and they have a cardiac arrest and die. So that's why it's really important that they take their medications. So knowing your antiarrhythmics, knowing as well also another common group is some antihypertensive drugs or drugs that produce an antihypertensive effect. Really good. One of this is when you often think about even diuretics. So diuretics, the main purpose is to get rid of all that excess fluid, right? So patients or that have CHF, right, congestive heart failure, we're going to give them diuretics to get rid of all the excess fluid, which will help them to breathe better, less congestion, which also can help lower the blood pressure too. But that is one of the outcomes, but the main reason why we give it is to get rid of that fluid, which produces their blood pressure to go down to normal. Another one, common medication too, is your medications that helps to thin the blood, right? So these are going to be, for example, thrombolytic agents. These are going to be like, for example, okay, you got Coumadin, right? Coumadin is also known as warfarin, right? So Coumadin, warfarin, same thing, commonly given to patients with AFib as well, because what it does, it helps to pretty much thin the blood, so that way they don't develop a blood clot, because they have a higher risk because they have AFib. So you have Coumadin, warfarin, and then also you also have heparin. Patients can get heparin injections. One thing you do want to pay attention to is what would be the antidote to the drug, if they have an antidote, or would cause the drug to be less potent. So for example, we know that with Coumadin, warfarin, the antidote or what would cause it to be less potent would be if they take green leafy vegetables, or vitamin K, right? So not every drug has an antidote, right? But you see it commonly with some medications, so you should definitely be aware of that. Another common meds you should know is all of your insulins, right? All of your insulins. You're gonna need to know all the insulins, right? Because insulin is a common drug that we give a lot, right? Because a lot of people have diabetes. So you should know the difference between each stage of, or let me not use each stage, but each type or category of insulin. So we have rapid, short acting, or regular, and then we also have intermediate acting, and then we also have long acting. So for those meds, right, you want to know the names of each group, right? I just mentioned over the 4 categories, but you want to know some common drugs for each group, for insulin, and then you also want to know what is the onset, what is the duration, what is the onset, what is the peak, and what is the duration. Now this is not a insulin video, but I have another video where I talk about insulin administration. I go over each of the insulins in more depth. All right. So these are some common meds you want to know. Also as well, his pain meds, narcotics, right? That's another type of group of meds that you're gonna see a lot, give a lot, right? So you should know oral narcotics, right? And especially if you're an RN, studying to become an RN, you should know IV narcotics. Commonly, drugs that we can give IV typically, and then drugs are usually only oral. So for example, Norco, Vicodin pills, right? But Dilaudid, morphine. Dilaudid can also be given in actually Dilaudid tabs, and then it can also be given IV. But if you give Dilaudid, you have to be careful how much you give and how fast you give it, because it can cause the patient to go into respiratory depression. all right, because of the type of sedative effects that it has on the patient. So Dilaudid, Percocet, extended release. You got to be familiar with those terms, the XR, right? What does it mean if it's XR? That means that you can't crush it, right? Because it has to work over an extended period of time in the body. If you crush it and give it to them, it's going to work too quickly, and it can have, even fatal effects, right? So that you got to pay attention to that XR, super duper important. All right, another one, digoxin, right? So honestly, you can't go wrong with learning lots of heart meds. Digoxin is a medication that we typically give to patients that have CHF, and that is given to help improve the contractility of the heart. So we're giving it, so when somebody has CHF, their heart muscle is weak, poor. They're not able to push, like contract fully in order to be able to capture enough cardiac output. So we give them digoxin in order to improve that contraction, which will also help to improve the cardiac output. So with all these meds I've been going over so far, another thing I want to mention too is to know the side effects, right? So what are the side effects? What are the adverse effects, right? So even with the digoxin, if they begin to complain of halos, vomiting, these are all adverse effects, honestly. And then it shows a sign of digoxin toxicity or overdose, which means they're getting too much, and so we need to let the doctor know. So being aware of the side effects, being aware of the adverse effects, super critical. So when you're studying all these common meds, so here's a really big tip. When you study all these common meds, you have to prioritize knowing the side effects versus the adverse effects. Why? Because you have a different intervention for both, right? So for side effects, the intervention is typically like we don't have to always do something. So it's more so educate the patient, let them know what's going to happen. But it doesn't require us to stop giving the drug because it's just only a side effect. It's expected. Versus an adverse effect is bad. Adverse effect is it needs to stop right away, otherwise the patient could die, right? So you have to know indications of a side effect versus an adverse effect. Really common one, vancomycin, right? Vancomycin is an antibiotic that's normally given in an acute-like setting to treat infections, right? And it's usually given through IV piggyback. When we're giving vancomycin, especially if the patient has never had it before, we want to educate them, make sure, let them know what the drug is for, let them know to let us know if they have any side effects, as they begin to get the drug. Side effect would be the complaint of stomach upset, diarrhea, right? GI upset. Those are side effects, right? So so it's important once again because the intervention is different. So if they're having all those issues about their stomach being upset, don't really need to let the doctor know because it's expected, right? When it's expected, you don't have to respond the same way. So instead, we could tell them, we could provide other solutions, right? Such as maybe Imodium or something to help appease their stomach, right? That's side effect. But if they're getting the vancomycin and all of a sudden their face begins to go red, their skin begins to become red, well, they could be experiencing red man syndrome, which is a rare but can happen adverse effect of vancomycin. At that point, boom, we need to stop giving the drug, right? Stop giving the drug and let the doctor know right away, because that's an adverse effect that needs to be responded to, and they need to stop giving it because this means that they are allergic to this drug and it can have a fatal response. And then also another thing too is that if you are trying to really pass your NCLEX exam and you've been struggling, you know, you don't know what you're doing wrong, or maybe it's your first time taking it, but really this is really for people who feel discouraged about the test, or just need to get some clarity as far as if they're ready, or they need to know what they need to focus on, then you want to take advantage of our NCLEX assessment program. This program, what I did, this is not like any other program that you're going to find anywhere, right? So because you could take a practice test, you could take a practice questions anywhere, and then the questions are going to tell you generally what you got right and wrong. So this goes beyond this. Not only does it tell you what you got right and wrong, but in the program, I actually help you to understand what you're missing, what your weaknesses are, what your weak areas are, and what you should focus on moving forward, as well as how to create a plan so that way you can be more effective with your approach with the NCLEX. If this sounds like something that you really want to be a part of, or that you really feel like you really need, then go ahead and click right now and take advantage of the program. Go to the link on the screen, bit.ly right /assess package 90, or click the link that is mentioned right now on the screen, and you can take advantage of it today, and you get immediate access. And like I said, inside the program I go over in depth. I talk to you, you'll have an understanding, like as far as in the program, I talk to you in the program through the video trainings and help you to understand what you need to know, what you need to understand, really just kind of guide you. And you'll just, we've had some people that shared how the program was very eye-opening and just gave them a lot of insight as far as what they're missing and what they need to do differently. So if that sounds like something you want to take advantage of, then make sure you click right now below this video to take advantage of it, either above or below, to take advantage of the program. All right? So once again, here's some quick recap as far as some of the things that you have to be aware of, right? When you're looking at common medications and you're trying to study common drugs, know the drugs itself, yes, but then also be aware of the mechanism of the drugs. So a lot of drugs, they may have the same outcome, but different mechanism. When it comes to the NCLEX is testing you if you understand the mechanism just as much as the outcome. As well, know the side effects versus adverse effects, because side effects and adverse effects have two different outcomes. And so when you get a question on the NCLEX, the way that it could be presented to you is that it could tell you the name, of the drug, tell you the scenario, and then it wants to see if you recognize if the scenario is a side effect or an adverse effect. So that's pretty much your ability to apply what you know, right? Applying what you know. So side effects, adverse effects, right? Understand the outcome, you know, and then just being aware of the precautions that comes along with when we're giving the meds. And then also antidote. Does this drug have an antidote? And if so, what is it? All right. So I hope that you found this helpful, and that you learned something from it. If you did, make sure you go ahead and hit the like, subscribe, follow button right now. Share this video with somebody that would find it really beneficial. Check out more below this video. Take a look at our free guide right now. Click below this video to get access to that and learn more about our courses, so that way you can get started and be able to succeed and pass your NCLEX exam in no time. All right, thank you for watching, and I'll see you the next time.